Good evening, everyone from Taiwan and all over the world. Thank you for joining today's webinar. So before we begin to webinar, I would like to introduce Dieter, who is the exotic vet specialist in Belgium. So Dieter, welcome to BioGuard and welcome to our webinar.
Thank you. Thank you for the invitation.
Would you like to introduce yourself and your
Yes,
current role and your some experience from your past work?
yes. Okay. I'm a veterinarian working only in exotics, but I think exotics in Belgium is a little bit different called than exotics, of course, in Asia. For us, exotics is rabbits, rodents,
Yes.
birds, reptiles, amphibian, fish. And ferrets. So not the real exotic ones you have in Taiwan and Asia, but for us, even rabbits is already not a major class in school. So when I graduated at school at the University of 2004, I graduated at a major
Mhm.
in small mammals and then a minor in exotic species.
Oh,
And then I
oh,
started my own practice, and now I work as a freelance vet.
yes, I remember that. I've been to your clinic and I saw a lot of different exotic animals over there and quite
Yes.
thrill and exciting. Yeah. So, yeah, before we begin this webinar, we would like to briefly explain why BioGuard is focusing on antimicrobial resistance awareness. As we all know that antibiotics may be still, frequently prescribed empirically without diagnostics confirmations, which may contribute to the development of antimicrobial resistance. So, as a veterinary diagnostic company, BioGuard recognized the importance of the diagnostic tools such as AST can play a very supporting role in responsible antibiotic use. So, though through this initiative or like talks like this and inviting renowned speakers like Dieter, we hope to increase awareness of AMR and support veterinarians in making more informed treatment decisions, ultimately, improving the patient's outcomes and preserving antibiotic effectiveness for the future. So, before we begin this talk, Dieter, I would like to know more about your perspective. How significant is antimicrobial resistance challenge? In Europe, I can say, and also in exotic animals, if you can shed some light on this.
Yeah, I think the antimicrobial resistance is a major risk at the moment in human health.
Mhm.
It's causing a lot of deaths. It's in Europe only it's 35,000 deaths a year in.
Oh.
It's 20% of human bacteria are already resistant when you test them. So it's quite a huge problem. But it's not only in Europe, it's in all of over the world.
Yeah, it's a global
There are
challenge.
a lot of deaths. It's more than 11
Mhm.
million of deaths a year. So that's quite big. In all over the world, it's a huge problem. So, and if you see it, you see resistance in all kinds of animals and humans, of course, too. I see it quite a lot in exotic animals, mainly because it's starting to getting better, but the main problem in exotics is most vets don't really know
Mhm.
how to treat it, and they just use the quinolones.
Yeah.
It is forbidden in Belgium to use quinolones without first antibiogram, but still it's very often used, and that's why we see so much resistance. Same problem now; it's better, but before in pigs and chicken farming, there was a lot of
Mhm.
antibiotic use in the feeding, and that's causing a lot of resistance.
So, talking about the challenges, like one challenge you already mentioned about some of the antibiotics, and the AST is required for their, previously if they are used. So are there other challenges, especially in Belgium, when selecting an antibiotic for any infection?
Yes, so as I already mentioned, the quinolones and third generation of cephalosporins, we can in Europe only use after an antibiogram. So you are not allowed to use it just empirically. But I think that's good because those antibiotics are quite strong. Those are the antibiotics also used in humans, and we don't want to have to get them really resistant. So that's why I think it's important. That's why I really love using the AST, because you can choose wisely the correct antibiotic. Problem in exotics too is that there are not so many safe antibiotics. As you already all know, penicillins in herbivores is quite toxic. So yeah, that's even
Especially rabbits, right?
yeah, indeed. That's even a bigger problem. So there are not many antibiotics available, and there is quite a lot of resistance. So even today, I had a guinea pig with a wound infection that's completely resistant to everything. So
Wow.
yeah, it's a huge problem.
So, and talking about the AST situation, so in today's scenario, what is the current level of awareness among veterinarians regarding such tests? So, if you can share some idea.
Yeah, so I think it depends. I think there are vets who see the importance of antibiotic sensitivity testing, and who are by that way interested in the AST machine. But there are still vets who just pick up their combination of antibiotic and anti-inflammatory without any testing or stuff like that. But it's getting to get a minority that way. Most are more know the fact that it's a problem, and they want to do testing. So, but yeah, then of course the problem is when you do testing, it's also getting more expensive for the owners, because
Pet owner,
yeah,
yeah.
you need to do an AST test though.
Okay, yeah, thank you so much for sharing, so much insights on AMR and AST testing. And with that, I think we can discuss about today's webinar topic, as well as
Yep.
share your, experience on the AST testing in your own practice.
Yep.
So you can
Okay.
start, yeah.
I'll try to find here's my PowerPoint. Okay. So, as we already discussed, wait just a moment. I'm going to put it in the right way. Okay. Okay. Can you all see it?
Yes.
Okay, so as we already mentioned, antimicrobial resistance or antibiotic resistance is a quite huge problem. It's 700,000 of deaths a year worldwide, so that's huge. And there are millions of infections a year with resistant bacteria. So it is, according to me, it's the most important thing to take care of at the moment. I think I already mentioned one of the reasons of the a lot of resistance is driven by the overuse and misuse of antibiotics. As said, using antibiotics like in poultry or stuff like that, just all of the flock treating that's getting more of a there at the moment it's not really done anymore, but before they used to do it, and that can cause a lot of resistance. Same thing with just using antibiotic even without knowing it is a bacterial infection. Yeah, it's a pity that still some clients just ask, why don't you give antibiotics? I think antibiotics are really important, but only if there's a bacterial infection, and if you know which kind of infection it is and which antibiotic is useful to use. So the thing is also that that's one important thing to know is that last 20 years there are no new classes of antibiotics anymore. There are no new antibiotics. So all the antibiotics are in the classes we already know. Okay, within a class we get some newer strains, let's say, but there are no new types of antibiotics. So which kind of antibiotics are possible? So there you have antibiotics who work against the cell wall synthesis of the bacteria. Those are the cycloserine, vancomycin, bacitracin, penicillin, cephalosporins, monobactams, and carbapenems. Then there are some antibiotics who work against folic acid metabolism. Those are trimethoprim and sulfonamides. Some work against the cytoplasmic membrane structure, like polymyxins and daptomycin. The quinolones are most important. They work against DNA gyrase. Then some antibiotics like actinomycin works against RNA elongation. And then we have antibiotics who work against the DNA-directed RNA polymerase like rifampin and streptoviracin. And some antibiotics work against the protein synthesis either in 50S inhibitors or 30S inhibitors. Like the 50S most important are erythromycin, chloramphenicol, clindamycin, and lincomycin. And then the ones against the 30S inhibitors that are the tetracyclines, the spectinomycin, streptomycin, gentamicin, kanamycin, amikacin, and nitrofuranz. And then the antibiotics working against the protein synthesis of mupirocin and pyromycin. So again, some repeatment. So those 5 classes we got, so cell wall synthesis, nucleic acid synthesis, antimetabolites, membrane disruption, and protein synthesis inhibition. And those are the only classes of antibiotics we know at the moment. So that's why it's so important that we make sure that the resistance against antibiotics that it doesn't grow, because we don't have other antibiotic classes at the moment. So how can resistance go from animals to human? Because of course, one really important thing I think all of you have heard about it is the human-animal connection and one health system, meaning that it's really important to take care of stuff in the animals so that it's also good for the health of the humans. Resistance genes and resistant bacteria can go with oral exposure via contaminated meat or fecal material go to humans, or by direct contact with colonized or infected animals. So also one important thing to know, it's the bacteria that's getting resistant. It's not the animal that is getting resistant, it is the bacteria. So transmission of resistant bacteria, you have 2 major ways. There's either the horizontal gene transfer via plasmids or mobile elements, and the second one, that's the vertical transmission during replication. So it's quite normal that when bacteria replicate, that the genes, the gene important for resistance are also in the new generations. So one important thing to know is, of course, we have the new resistancy, so the acquired resistancy, but some bacteria are also intrinsic resistance. That means that some of the bacteria can't work even when there's not an extra resistancy. That is the possibility with gram-negatives because the reduced outer membrane permeability. So gram-negatives are less susceptible to bacteria that worked against the outer membrane. And some bacteria have constitutive efflux pump activity. So that means that they can pump the antibiotic out of the bacteria, so the bacteria can't work. So some really important and really common bacteria with their intrinsic resistance. Mycoplasma, as you all know, they don't have a cell wall. So antibiotic like the beta-lactams who work against the cell wall, they're not working. That's typical because they don't have a cell wall. So Enterococcus species have a low susceptibility to cephalosporins and lincosamides. Listeria species are resistant to cephalosporins, Klebsiella species to ampicillin, Pseudomonas and Acinetobacter have already a quite broad intrinsic resistance. That's why we always see so much antimicrobial resistance in those bacteria because they already have an intrinsic resistance, and those are most known of very extra resistance they get. So Bacteroides species, they have a resistance against aminoglycoside, and the Enterobacteriaceae have a limited macrolide susceptibility. So some others reduced. So the cellular and molecular resistance mechanisms. So which mechanisms are important ways of getting the resistance? So there, as already said, there are some efflux mechanisms. So or there is a reduced intracellular concentration. It's either by an efflux or decreased permeability, or the porins or the places where the bacteria can get in, there are reduced or changed or stuff like that. Other possibilities where bacteria can get resistant, there is a target modification, so like the ARM methylation and GIR-A and GIR-A mutations. Then there are enzymatic inactivations with, that's, I think all of you know it, the beta-lactamases. They break down the beta-lactam antibiotics, and because of that they're resistant to the beta-lactams. Then there are some aminoglycoside modifying enzymes, and that X, that's another enzyme, can also be a metabolic bypass with DHPS or DHFR mutations, and very well known, of course, is a biofilm formation. The biofilm formation, that's something bacteria can produce. Because of that biofilm, there is a reduced penetration, and the bacteria are resistant to the bacteria. So vancomycin also, it's a new, it's one of the newer antibiotics, but the problem is that there's already quite a lot of resistance in vancomycin against all kinds of antibiotics. Those resistance is triggered by Ven genes who alter the D-ALA precursors or efflux pumps. So beta-lactam resistant mechanisms, you have altered or acquired protein binding proteins, active efflux of beta-lactams, and beta-lactamase hydrolysis. So this is all really theoretical stuff, of course, but it's really important to know how those bacteria can get resistant to the antibiotics. So knowing the fact that there's already a lot of resistancy, which steps you need to go go for a AST. So first, it is important to think about which antibiotic will possibly be present at that place. As you all know, the mycoplasma, that's quite a common infection in airways. The Pseudomonas infections of the skin, or Staphylococcus in the skin, and then you need to consider the intrinsic resistance. Like mycoplasmas, you're not going to treat with an antibiotic that works against the cell wall. And then the other step is to take a good swab. What is a good swab? You don't take a swab just of the pus. You take, if possible, you take a swab after a gentle cleaning and a swab of the capsule of the abscess. That's really more useful than just taking a swab of the pus. And then you need to go to the AST to see which resistance the bacteria got. So another thing, of course, we're going to go into the AST machine itself, but something that can be really interesting is cold plasma therapy for those resistant bacteria, because by plasma there's a reactive oxygen and nitrogen who works against the bacteria and against the biofilm. So then the miniAST is a rapid AST testing. Results within 6 hours. 2 tests simultaneously are possible. Automated interpretation, and there's a 92% agreement with disk diffusion. Suitable for urine. I use it quite a lot of urine. Skin, ear wound swabs, tracheal swabs, and stuff like that. So those are the steps you need to do. You need to have either a swab you put in saline or fluid, that you put that into the incubation fluid. Then after incubation, you dilute it in your test rotor, and then after 8 hours you have the result of your AST. I think that's something we as a veterinarian, it's really important. As said, resistancy is a huge problem. I think it's really important to start right away with the correct antibiotics. So to explain some of my cases, you can see there, I can show you that there's a lot of resistancy, and I will show some cases now. So as said before, for a good case, first wound cleaning and no sample from the pus. So this is Leon, a rabbit with dental problems. He had some surgery with extraction and marsupialization. He had quite big abscess before the surgery, and then we took a sample of the capsule you put it in sodium chloride, and then we used that for the AST testing, and then what we saw was this. As you can see, it's still susceptible to doxycycline and rofloxacin and trimsulfa. The thing is, trimsulfa, okay, we can know the trim sulfa is the bacteria is susceptible to trim sulfa, but trim sulfa is known that it doesn't penetrate really good in pus. So in those cases where there's a lot of pus, I wouldn't advise as a first to start with trim sulfa. So in this case, we used the doxycycline, of course, after the operation, and within a few weeks, the abscess was completely cured. So another case, Indy, also a rabbit with a dental abscess, and here it's even worse. As you can see, the only thing we can use is amikacin. The problem in Belgium is we can't get amikacin, and even if I could get it, it's quite nephrotoxic for rabbits, so I don't advise using it. So in this case, we did flushing of the wound, taking out as much debris and teeth as possible, yeah, we managed it that way. So another case of a chronic wound in the wing web of Paco arapornis. It's something you see quite often in arapornis. They're quite susceptible to feather picking, and then they get wounds in the wing web. So something really important. So we took a swab. As you can see, there's a little resistancy, but less as in cases before. We can use ciprofloxacin and enrofloxacin, gentamicin, and levofloxacin, and trimsulfa. So in this case, we used laser therapy instead of the cold plasma therapy, because at that moment I didn't have the cold plasma, so I used laser for wound cleaning. And then we used the trimsulfa orally and ciprofloxacin eye drops locally for 5 weeks, and in 5 weeks it was cured. So another rabbit with really bad teeth, as you can see, there's an abscess here. So what we did was we took out all involved teeth, and we flushed the abscess with hypochloric acid. We treated afterwards with laser, and in this case we put in some gentamicin beads after surgery. As you can see, gentamicin was intermediary resistance, but the good thing is when you use gentamicin beads, you can locally you can get a quite high concentration, so you can treat locally without the main problem of kidney problems. So as said, I treat all kind of animals. So this is Molly, a chicken who came in with acute dyspnea. In dyspnea in chicken, first thing I check always is to check for trichomonas. So that's a flagellated parasite. So that was negative. And then I did a bronchial alveolar lavage, and what we saw was this. So this is already more resistant. So there is a sensitivity to amikacin, but as said, yeah, it's difficult to get in Belgium. There was a sensitivity to gentamicin, to trimsulfa, and ceftriaxone. In this case, we first started with trimsulfa. There was a minor improvement. Then after 10 days, we added augmentin, and then it was cured after 10 days. So in 20 days, it was cured. So another guinea pig, Vanille, he was limping. We took an X-ray, and as you can see here, quite a lot of feet are infected. So we did an amputation, and we took a swab of the infected bones, what came out was quite resistant bacteria who was only susceptible to trimsulfa, but as said in pus it's quite difficult, and to augmentin and intermediate to doxycycline. This case, unfortunately, the guinea pig died because of sepsis. So, as a conclusion, there's a lot of antimicrobial resistance all over the world and in all kind of animals. So they're in livestock, but in humans, in small mammals, in large animals, in all animals we see quite a lot of antibiotic resistance. So it's really important to do a test. I really completely advise against blind treatment. I think that's, as you can see in the one once all the biograms I show you, they're all some kind of resistance. So I think it's really important to do in every case an antibiogram, and of course it's important to start with the right sample. So don't take the sample from the pus, but take it from the capsule. Also in reptiles, for instance, it's not so much of a good thing to use antibiogram on fishes, because most of the time it's more parasitic, it's not bacterial. So that's important to, of course, know what you need to treat. Okay, so that's all I got for now.
Thank you, Dieter, for sharing your practice and a lot of insights I got to learn today from you, and some of the cases which I learned that you have used AST in clinic AST solutions for dental problems, for wounds, and for dyspnea in chickens. So, other than that, are there any other particular situations or infection types where you believe AST should be strongly considered before initiating the treatment?
I think, honestly, in every infection, it is important to just first to check for sure it is a bacterial infection. And if you know that's a bacterial infection, by do skin scraping or whatever, like urine, you can examine by microscopy or do a diff quick of a staining, stuff like that. If you know that's a bacterial infection, then I think we can't allow ourselves to do blind treatment anymore. It's the problem with antibiotic resistance is so huge. I think we're obliged to do antibiograms in every bacterial infection.
Okay. And as a veterinarian, what barriers currently, you think are preventing for the wider adoption of AST testing, especially when we know that I think in Europe, most of the vet clinics are, sending samples to reference lab. And now, since BioGuard have, invented or developed the in-clinic miniAST solutions. So that is also being preferred by many of the vets like you in your practice. However, still AST, if it's not in routine, so what barriers you think are there that is stopping veterinarians for doing the AST?
I think one of the problems is also is always the money. If you do it in-house, you need to be able to get a profit, and that makes the problem is in Belgium is our labs are really cheap. So the problem is that if you do it yourself, it's at least more expensive than you send it to a lab. So, and the problem is that it's already difficult to convince owners to get an AST, and then if it's getting more expensive, that might be a problem.
Mhm. And looking ahead also, how do you think that diagnostic laboratories or companies like us can together work together or should support veterinarians? So what kind of support a vet can expect from these services?
I think the best thing is that in AST, if you do it yourself in your
Hmm.
clinic, it's way faster. If you send it
Yeah.
to the clinic, it takes 3 days before you get a result. If
Yes.
I I had a guinea pig with a really bad infection this morning. I put
Hmm.
the AST machine in, and I know tomorrow morning I have the results. So I can start with the correct antibiotics. And that's important because, as said in one of the cases, yeah, they can get sepsis and die of sepsis. So you need to
Yes.
have the correct antibiotics and not in 3 days because, yeah, exotic animals are way more susceptible to disease. The problem is when they come to the
Hmm.
vet, most of the time they're already really ill, as you can see the case in with the guinea pig who already lost some toes before they got to the vet. It's not possible in a dog. In a dog,
Hmm.
yeah, they would have come way earlier, so it wouldn't have been that bad. So, but that's a problem in guinea pigs and all other rodents, all small mammals. They hide their problems. So when they come in, it's quite a big problem. And because of that, it's really important to have the results as fast as possible. That's why I really think in-house lab is really important.
Okay, thank you. So also there are some of the questions asked by the listeners,
Yeah.
and I'll pick some for you. So this is a question from, I think, a listener from Indonesia, and they are asking, like, does AMR also occurs in ophthalmology cases? And
In sorry, in what cases?
in ophthalmology or ophthalmology.
Ophthalmologic. Okay.
Yes. Sorry for my pronunciation.
No. Sorry. Yeah. Yes. Yeah. Indeed. Yes. Even in eye infections can have quite resistant bacteria. That's why even for I didn't mention one. I've done several in eyes too. Yes, I take swabs of an eye too to see which bacteria is in it because yes, I see quite a lot of resistance too, and it's the main problem is there are only a few antibiotic drops, eye drops commercially available. So quite often we see the resistance against those antibiotics. So that's why also when in to be honest in eye infection mostly I start with an antibiotic. If it's not getting better in 3 days, then I do the swap. But that's quite fast already. So normally you see an improvement right away. If not, it's really
Mhm.
important to check if there's some resistance, because even in eye the eye bacteria are
Mhm.
getting more and more resistant.
Okay. So next question I'll pick is, what do you think about giving an antibiotics in viral infection to prevent secondary bacterial infection?
Sorry, can you repeat that?
What do you think about giving antibiotics in viral infections to prevent secondary bacterial infection?
Yeah, that's rubbish. Sorry for saying that, but that's really not necessary.
Yeah, it's
What you
not a
need to
good
do,
practice to do that. Yeah.
yeah, it's really not a good practice to. It's like preventive preventative antibiotics. It's useless. An antibiotic only works
Mhm.
when there is an infection. It's not going to work when there's no infection. So when there's a viral infection, what you need to do is give anti-inflammatories, give antivirals. So that way you can prevent secondary infections. I really wouldn't advise giving preventative antibiotic against possible secondary infection. If you got
Mhm.
a secondary infection, of course, then you treat it, but not preventative.
Okay, thank you. Thank you. Yeah, I also agree with you on this thing.
Yeah, I think
So,
it's quite common practice to do it, but I think we can't afford to do it anymore. There's so much resistance. If we're going to misuse antibiotics in 20 years, there will no antibiotic treatment
yeah.
possible anymore. So that's why I think now we need to do really responsible antibiotic use.
Yeah, I think this habit is usually developed by humans because, even sometimes we have a viral infection. A lot
Yes,
of times we are
that's
taking
indeed, yeah.
antibiotics for that.
That's indeed a problem. I discussed that with my own general practitioner. I went to the doctor for an infection, and he just gave me antibiotic. And I asked, Aren't you going to do an AST?" "No, that's way too expensive." And I was like, "What? I'll do it myself." It's completely rubbish. In veterinary science, now you're almost obliged to do it, but they don't even do it in humans, and we do it in veterinary science to protect humans. So it's rubbish, but yeah,
Yeah.
it's a problem.
Okay, let's go to the next question. So there's someone saying, can AMR transfer from hen to chicken via the egg?
Um, yes, probably yes.
Okay.
Not by the egg itself, but by the contamination of feces from the egg. Yes.
Okay. And next question is, what are the main bacteria and susceptible you have seen in freshwater turtles with carapace rote infection?
Yeah, there are quite a lot is Pseudomonas, Aeromonas, so water-loving bacteria
Mhm.
with quite a lot of resistance. Yes. So yes, in Carapax infections, it's important to do an antibiogram and also to test for fungal infection because quite often it's a combined fungal and bacterial infection.
Okay. And this case is more related to surgical procedure. Is saying it is same. It is the same in the case of pre and post surgical antibiotic administration. So I think the listener wants to ask if we administrate antibiotics pre-surgery or
Um,
post-surgery,
it,
what will be
it,
the
it, de-
difference?
it will depend when there's a quite huge dental infection. I start with Most of the time I start with doxycycline because I know there's not a huge resistance against it, and it's an antibiotic that really penetrates really good in bones and teeth. But afterwards, during the operation, I take a swab, and
Mhm.
then I know which antibiotic I need to give afterwards. Is that an answer to the question?
Probably, yes.
Yeah,
Okay. Next question is, what infection cause farm animal like chicken to from suffer from catarrh? Do you know what is that? Like, it's not written
cataract.
correctly.
Cataract. Um,
CATARRH.
It's probably
Cataract.
cataract. Cataract.
Yeah. Yeah.
Yeah, I think they're referring to not bacterial, but a viral infection, Marek's disease. So it's a
Mhm.
viral infection that can cause troubles in the eye. So I think they're referring to that. The problem it's a viral infection, so antibiotics are completely senseless to giving it. So
Okay, since you're from Europe, and I think this question probably asked from Asia, so they are addressing the implication of antibiotics, without regulation. So their question is, how do we increase, such regulations, especially to the countries that are easily to blindly treat diseases without diagnosis?
Yeah, of course, I don't know the legislation in Asia, but for already 4 years in Europe, it's the legislation is quite
Mhm.
getting bigger and bigger. Like as I said, the quinolones, third generations, cephalosporins, you only can use it after a antibiogram. So, but I don't know. Sorry, I don't know the legislation in Asia, but I think that way should be everywhere because yeah, especially those last resort antibiotics, you can't use them for
Mhm.
everything. It's too dangerous to use it for everything because it will cause more and more resistance.
Okay, I think this is also a very regional question and very interestingly asked from Africa continent. They are asking how are African countries, especially Nigeria, go to overcome the increasing raise in the cases of AMR in livestock production.
I think it's the same that was before in Europe. Like, don't use prophylactic antibiotics. Just use antibiotics when it's necessary after an antibiogram. That's the way you should do it because if you do a group treatment or if you use antibiotic prophylactic, that's the way you're going to get resistance.
Mhm. Okay. Okay, this question is related to snakes, but let me recite the question first. It is almost a normal practice for veterinarians to send antibiotics to patients with venomous snake bites to prevent infection. What do you think about this practice? Do you know about it?
I don't know, sorry. Venomous snakes are forbidden in Belgium. So, but do they mean that after a snake bite, a snake bites a human and they give antibiotics for the humans, or what is exactly the question? Because
That's why I say because in the question it's mentioned that veterinarians to send antibiotics to patients with venomous snake bites to prevent infection.
yeah, in Europe, for sure, you're not allowed to send antibiotics without seeing the patient.
Mhm.
So we couldn't do that. I don't have any experience with
Okay.
snake bites because yeah, we don't see it here. So sorry.
Yeah, because usually for the snake bites, people will go to the human doctor, not to
Yeah,
the
yeah, indeed.
veterinarian.
You need
Right.
to go to a human doctor and you need to get some antivenom. So
Yeah, not the
I,
antibiotic.
I don't think that antibiotics going to cure a snake bite. It's going to be your antivenom that's going to cure your snake bite, not an antibiotic. So
Okay. Okay, this question is from Philippines, and the listener is asking the Philippines has both intensive aquaculture and flood-prone river systems in the same geography, are essentially creating open air AMR incubators every rainy season. Uh,
okay, I think he's or he or she is referring to the fact that indeed in some Asian countries there's quite a lot of shrimps factories
mhm.
that use, of course, the water from rivers, and yeah,
Yeah.
when there's a flooding, and indeed that's a huge problem in shrimps. They use antibiotics prophylactically. So like they did before in cattle and chicken, they just use antibiotics because they say otherwise the shrimps are not going to grow. Yeah, that's something. Yeah,
Mhm.
that's a problem. It's we used to do it in Europe too in livestock, but I'm really glad that it's not a lot anymore in Europe. So I think. Because before also I see it in even in bird breeders. They always said to me,
Mhm.
yeah, but we can't grow our birds without antibiotics. And I said, okay, let's start just without antibiotics. And of course, your breeding season is going to be a few times less, but afterwards you have parents who are really more healthy and they don't need antibiotics anymore. I think the same will be necessary in shrimp factories and stuff like that. Yes, it's going to go, the culture is going to go down a little bit by not using antibiotics anymore, but after a while you're going to get a strong shrimp who doesn't need antibiotic to grow anymore. And I think that's important, because otherwise, yeah, we get the antibiotics as humans because we eat it, it's getting in our water. So yeah, I think it's really important to get away of those practices.
Okay. And this question is related to also AMR. Is the listener saying, does AMR test within one individual can vary over time? And if so, why?
Yes, because it's the bacteria who is resistant. It's not as I said, it's not the dog or cat or whatever that is resistant. It's the bacteria. So you can have an infection in your skin with a resistant bacteria, or not so much resistancy, and few months, years later, another infection in your skin with a completely different antibiogram. So yes, if it's a different bacteria, it can get another resistancy pattern.
Okay, this question is related to metastasis. So they're saying, what will be the response to combining different antibiotics for a specific infection, like cases of metastasis? Yeah,
Mastitis. Yeah.
metastasis. Yeah.
Yeah. Okay. So I think if you have an antibiogram that says um, this or this this or this antibiotic can be used, then there's no necessity to use a combination of antibiotics. So most of the time, it's not necessary to use a combination of antibiotics.
Mhm. And I think this is a very interesting question. And we also see one of your slides where, the result has all resistance. So this question
Yes.
says that what is the guideline procedure, or maybe your experience or recommendation when the results of the AST test is all resistance and almost all
Yeah.
antibiotics are not,
Yeah,
workable?
yeah, that's indeed also an ethical problem, because some of my colleagues say when you see such kind of resistancy
Hmm.
in an animal, you need to put it down because it's way too much of a risk for the humans.
Yeah.
Honestly, I don't do that. As long as the animal is not suffering from that infection, I try by treating with hypochloric acid and like the cold plasma therapy to get to help the body cure the infection. But indeed, there is something you can say about when there's a lot of resistancy, if it's still ethical okay to go for treatment in an animal, because yeah, the resistance genes, as mentioned, they can go from that animal to humans, and yeah, then of course it's a problem. But I always inform clients,
Hmm.
take care when you treat a wound, wear gloves and stuff like that.
Okay, thank you. This is very informative. And I think this question is not related to AST, but it's more related to the practice in poetry, that they're asking about the growth promoters being used in poetry industry. So should these growth promoters be discouraged or banned, from
Yeah,
the market?
definitely. Growth promoters with a basis of antibiotics, yes.
Mm.
There are all other stuff like feed supplements with
Yeah.
carnitine and vitamins and stuff like that. Yes, that's good, of course. But yeah, I'm 100% against use of prophylactic antibiotics. I really
Hmm.
don't think. I even think if you only can get those animals with antibiotics to grow, we must stop just breeding them, because yeah, it is, there's no common sense of yeah growing an animal in antibiotic. with only that's only if the animal can only grow with the antibiotics, there's something fundamentally wrong, according to
Mhm.
me.
Okay, thank you. Thank you. I think there are a lot
You're
of
welcome.
questions, but I picked some of the
Yeah.
relevant questions from the whole
Yes.
bunch.
Okay.
And finally, to conclude, I would like to ask you, or what key message would you like to share with the veterinarians and the probably, the new veterinarians probably who are still studying and listening us today regarding antimicrobial resistance and responsible antibiotic stewardship.
Yeah, I think, as I already mentioned a few times, responsible antibiotic use is really, really important. If you don't do it for the animal, think about humans. So I think whenever possible, try to get an antibiogram, so at least you know which antibiotic you can use, and don't use prophylactic antibiotics because, yeah, it's useless.
Okay, okay. Thank you so much for
You're welcome.
today's talk and sharing your experience. Yeah, it's always great to invite you for the talk, and you always
Thank you.
have great topics to discuss with us, and also to join our continuous program and educating our vet community. And for those who have joined us today, until now, we will be sharing you a certificate of attendance signed by Dieter later to your emails. And if you haven't registered and still listening, please put your email address in the comment box, and that will also be, given certificate later on. So thank you so much, Dieter.
Yep.
Yes, yes, please.
I already saw in questions that quite a lot wanted to know if they get my PowerPoint. Yes, yeah, I am willing to share them. Not a problem.
Yes, because I think it's 100 questions that are
Yes,
on the
indeed.
comments
So
that are saying
yeah,
about the
so
presentation,
yeah,
of
yeah. So
course. So
not a problem for sharing that. Yeah.
yes, yes, we will be sharing you in few time after the talk. So thank you
Yeah.
so much, Dieter, for joining us
Yeah. You're
today.
welcome.
And this will conclude our today's talk. And I hope to see you next time with another
Yes.
interesting topic. Okay.
Yeah.
Thank you.
Okay.
Thank you
Yeah.
so much,
Goodbye.
everyone. Good night from Taiwan. Bye bye. Bye bye.